activists in the health sector hold the view that mental health is one field of well-being that is highly ignored in society. Some have even gone further to say that the effects of COVID-19 that continue to impact mental health, with October being Mental Health Awareness Month. Let's find out how widespread these challenges are in South African society. Let's speak now to Nkini, who is a board member, a senior spokesperson at the South African Depression and Anxiety Group. So a very good morning to you. Thanks indeed for your time. We appreciate you making time to be with us on the program. Give us an overview, first of all, of the scale of mental illness in South Africa. How big a problem are we dealing with?
It's absolutely huge, Griselda. We are saying at least 1 in 3 people in South Africa do suffer from any type of a mental disorder at some point in their lifetime. And of course, shocking as the statistics are, a lot of people are still not being included in these stats because they're not presenting. So we know that at least over 70% of people that have a mental disorder are actually not receiving treatment and management of their condition. So it really is a huge problem in South Africa. And of course, you've seen the increase, in suicide rates, across the board, young people, adults. So it is telling us that, mental illness in South Africa, we are not where we would like to be. And when you then look at the culmination of COVID-19, that has also exacerbated, this problem.
And the youth seem to have been identified as the key affected population. What are the contributing factors to this?
Young people in this day and age, they're really faced with humongous challenges. I think if you look at the state of the, the socio-economic issues, in our country, young people put in, a lot of effort into, studying and really trying to make, life for themselves and their families. And we've got a huge unemployment rate in South Africa. And so that also, adds to the problem, but also social media, yes, the digital advancement, it's been great in our lives. We are now conducting this interview via, the digital platform. So it has really had some positives, but also it has had negative impact. If you look at the peer pressure that comes along with it, you look as well, the bullying, the cyberbullying that has increased over the years, but also easy access, to substances, recreational drugs, alcohol, that also, creates a big problem, for young people.
And I want to talk about
that. Really, the societal pressures are huge.
Sorry about that, Nkini. And I also wanted to talk about the relationship perhaps between substance abuse and, mental illness, or how it contributes, towards that sustained problem amongst young people.
Absolutely. We know that, in fact, I should say that substance abuse, is also a type of a mental disorder. And of course, it's quite prevalent. It's one of the top 5 mental disorders in our country. Now, the relationship between substance or use of substances and how that feeds into, the whole cycle of mental illnesses is that a lot of times people tend to alcohol and other forms of recreational drugs to try and numb the pain, to try and cope, with their condition. But of course, we know that it has, ripple negative effects, which really creates a vicious cycle, because when you then sober up, unfortunately, whatever that you are dealing with is still there. And in fact, it actually is making your condition to even be worse. Now, for young people, starting to use things like marijuana, dagga, at an early age, it has physiological and physical, effects, or I should say consequences, that really would then hamper, how well, that young person would, cognitively, behave or cognitively, achieve what they need to achieve as a student. And of course, obviously, with the physical symptoms thereof.
You know, some statistics that our researcher here at the SABC, Zandimyeza, sent to me indicates that suicidal behavior among students is high. And it says that 8.6% of students have made a suicide plan and 2.3 admitting that they made a suicide attempt. This is really, really worrying. How can we address this?
It is. It is absolutely startling. You know, we're looking at about 8,000 suicides a year, you know, in South Africa. So it is absolutely startling. What can be done? Really, the good news is that suicide can actually be preventable. So being on platforms such as these, really creating the education and the awareness around mental illnesses and how to get help, how to get the proper care, management, you know, of the mental illness, we really would be then able to start turning the tide. We know that suicide oftentimes, you know, it's a consequence, a severe consequence of untreated mental disorder such as depression, bipolar. It could even be a type of an anxiety disorder. So it's important that people, you know, get educated and get the treatment that they so require if they are diagnosed with a mental disorder. And in fact, it could be yourself or even your family member. So it's always great that, you know, people also do reach out to us as the South African Depression and Anxiety Group and just do your mental health check. You know, we've got questionnaires on our website that, you know, people can actually engage with just to give a guide, you know, to say, you know, am I okay, am I not? And really, I always say, better be safe than sorry. So speak to us as SADAG. We've got trained counselors. We'll then be able, you know, to offer, you know, the help and really ensure that we can link people with, you know, the experts and the medical, you know, team that they so require.
Mr. Phasha, you did touch on this a bit earlier on, but I mean, the World Health Organization also pointing to COVID-19 having played a huge role in increasing, you know, the statistics in terms of depression. People have lost their jobs. They're dealing with so much. You know, how can that aspect, you know, be dealt with? Because, you know, the issue of job losses, unemployment, and everything else that has come with COVID-19 has certainly put a strain on the world's population.
Yes, absolutely. And you know, we have seen at least over 20% increase, particularly if you look at the key mental disorders, you know, in South Africa, depression and anxiety disorders. So there has been a significant increase, but we know that obviously it's not unique to South Africa. It's, you know, globally. I think, you know, we're not prepared, you know, for this pandemic. And really the ripple effects of, you know, COVID-19 are still going to be with us for quite some time. You know, we know that some households have lost breadwinners, have lost both parents. It's now young people that are now having to fend for themselves, you know, to provide for themselves. So without a doubt, that will have a severe impact on the mental well-being, you know, of our people. I think it's important, once again, that, you know, we empower ourselves, you know, about these potential risks, about, you know, the importance of really, you know, having that mental well-being. Because, you know, Griselda, it starts in the head. That's really the engine of our bodies. So if it's not well in the head, it's going to affect the whole body. So, you know, let's empower ourselves to learn more about, you know, mental illnesses, to learn more about how is it that we can actually, you know, support ourselves, but also support our loved ones. And where can we get help? You know, so as the South African Depression and Anxiety Group, really, we are here to, you know, to do exactly that. We are here, you know, to really work with our communities, you know, to empower our communities. We run various programs that really people can log onto our website, our social media platforms, and really in that way engage with us. And of course, October being, you know, Mental Health Awareness Month, and Monday is Mental Health Awareness Day. But for the whole month, we'll be running various, you know, initiatives and campaigns to drive the awareness. To also, one of the big things that really is a hindrance for a lot of people to get help is the stigma. and the discrimination that is associated, with mental illnesses. So really driving, all those initiatives and campaigns, to really start hoping and hopefully to turn the tide in what, we are seeing in our society.
And that is so true, Mr. Phasha. In our communities, in Black communities, you often hear someone, when you perhaps would do something out of turn, somebody would make the remark to say, we are hlanya. And, there is stigma that you talk about that, is associated with mental illness. How does this affect the treatment gaps then that we see in our communities to deal with this scourge?
Indeed. Indeed. We know that at least a third of, people that suffer from, a type of a mental disorder are getting treatment, management, and care. So there's a huge portion of people that really, they don't feel comfortable to come forward, and seek help. And when you talk, mental health or depression and men, that is also another phenomenon, that really is holding a lot of us as men back to come forward because we are afraid that we're going to be labeled as weak. Tigers don't cry. Those, the whole, myths, around this and really how we have been socialized. And so certainly out of fear to be stigmatized, out of fear to be discriminated, people tend to bottle it in. And people then seek other means, to try and cope, like looking to substances and recreational drugs. Even prescription drugs, you can actually get hooked on those. And also they have far-reaching consequences as well, because people really feel like, let me try and keep this to myself. Let me try and make sense of it and cope with it. But of course, we know that the more it perpetuates, it's not treated, it becomes more severe, and ultimately, really leading one to look into suicide as the only solution and as the only way out. So it's important that we start challenging, these myths, the stigma, the discrimination, and really how we even, the words that we use. And sometimes people don't understand that, you're saying something, perhaps not really being malicious about it, but really for someone who is actually suffering from depression or anxiety or any other type of a mental disorder, that really can really give a huge blow to them really being able to come forward and get the help that they so require. So definitely we need to be encouraging people, to come forward. We need to really change the mind shift in terms of, the things that we say, how we raise our boy child, how we socialize, to ensure that we can start seeing, a positive change in as far as mental health is concerned in South Africa.
And just finally, Mr. Phasha, is mental health, looked down upon in Black communities? A friend of mine, in fact, as we're on air, Charlotte, just sent me a message, and she says, she believes that mental health is underrated in Black communities. Is this what we see?
Indeed. There's lack of awareness, and there's lack of understanding, which then just fuels, this ignorance. And I respectfully say ignorance, but purely because people don't understand. Remember, we have been socialized to believe that, what possibly can be wrong in your head? This is a white man's, disease, and Black people or, any other, racial segment in our society, should not be suffering from something like this. This does not exist. It's all in your head, or you're making it up. Some go as far as even having their traditional beliefs or cultural beliefs, that if you are suffering from a type of a mental disorder, you have been bewitched, and therefore you must actually then be taken, whether you are being taken to traditional healers and so forth. And indeed, people see the extreme, part of the mental disorder, such as schizophrenia. However, then everybody who is suffering from whether depression, anxiety disorder gets, labeled the same way. So really, these are some of the key challenges, and which is why as SADAG, we go into communities, we engage with traditional healers, we engage with, traditional churches even, because, some obviously within our communities will go there, to seek help. So to enable them to be able to identify when someone presents with a type of a mental disorder, and then, channel or direct, that person to get proper medical care for their condition.
Mr. Phasha, thank you very much indeed for joining us on the program. Very enlightening indeed. Thanks indeed, Nkini Phasha, who is a board member and senior spokesperson of the South African Depression and Anxiety Group.